This is the most commonly applied McKenzie exercise of just about any McKenzie exercise given. The reason it's so common is it frequently relieves majority of back problems. Something like 60 to 70% of low back problems are improved with this exercise. Obviously you should get a McKenzie assessment first to determine its appropriateness for you, but just to show you how to do the technique, this is how to perform it. So typically the exercise is called extension in line. If you can rest on your forearms in a nice high position with your legs slightly apart, if you can take some deep breathing, if you watch the lower part of my back, you'll see even with deep breathing, if you try and actively take some deep breaths and relax your spine and buttocks and legs as much as possible, even the deep breathing applies some gentle pressure to your spine, which then often makes the exercise more effective if you've spent 1 to 2 minutes doing this first, ideally if you have the time. After doing your 1 to 2 minutes on the elbows, then you're ready to do extension in lying. With extension in lying, the hands need to be under your shoulders, not up here somewhere. And when you push up, the key thing is to push as high as you can, if pain permits. If it is painful, you should just go to the edge of the pain, but with repetition, if the exercise is correct, frequently you'll be able to go higher with each one. If you're not limited by pain, you must get all the way up, and to do this, your elbows should fully straighten. So when I get to the top, my elbows should be fully locked, and you'll notice when I do this, my pelvis lifts slightly off the ground. This is important because most of these problems are quite low, and if you fail to lift up, you won't get enough pressure in the area that needs it. Typically we do 10 to 12 of these in a row, each time fully lifting, pausing there for a second or two, and you can see my back sags down. Once you feel that you're able to tolerate it, or if you're not limited by pain, at least the last 4 out of 10 should be performed with a sag. The main difference with the sag is that when I reach the top, I now breathe all the air out. As you can see, when I breathe all the air out, there is more extension in my back and a bigger range of movement down here. This is necessary because it pushes all of the disc back in, and most people find if they perform it in this way, it is significantly more effective. The other thing is, a lot of people have difficulty always being able to lie down, depending on where they are. If they've got out of the car and they're sore, you can certainly do the standing version of the exercise where you support your back, you arch backwards as far as you can,